Welcome, beloved seniors. Today, we're diving into everything you need to know about arthritis in the hands, with a focus on osteoarthritis. We'll walk through how to tell osteoarthritis apart from rheumatoid arthritis, review the common symptoms, and most importantly, cover practical steps you can take to feel better and stay active. If you find this useful, please like and subscribe and share with anyone who's struggling with hand arthritis or has questions. That really helps us reach more people. Let's jump into the 5 key things to understand about hand arthritis. First, not all arthritis is the same. A lot of folks worry they have rheumatoid arthritis when they notice changes in their hands, so it helps to know the differences. Both osteoarthritis, OA, and rheumatoid arthritis, RA, can cause pain, stiffness, especially in the morning, grip weakness, and visible changes in the hands. Those shared symptoms are why people often confuse the two. But after that, they tend to look and behave very differently. Rheumatoid arthritis is an autoimmune, inflammatory disease that frequently involves many joints and other body systems. With RA, you can see warmth, redness, swelling, and signs of inflammation beyond the hands, fatigue, fevers, and sometimes complications in organs. RA most commonly affects the wrist and the knuckles, the metacarpophalangeal joints, MCP. Those joints can become swollen, tender, and inflamed, and the changes in hand posture can be distinctive. By contrast, osteoarthritis is a wear and tear, degenerative condition centered in the joint itself. It happens when cartilage thins and the joint surfaces change over time. OA tends to be limited to the affected joints rather than causing systemic symptoms. Where OA shows up in the hands is often different from RA. OA commonly affects the middle knuckles, PIPs, the end knuckles, DIPs, and particularly the base of the thumb. Those end knuckles can become bony and enlarged, producing the classic knobby appearance. The thumb base, the carpometacarpal joint, is a hallmark location for OA. When that joint hurts, it's a big clue that OA is the cause. Visually, RA often produces a drifting of the fingers toward the ulnar side, what clinicians call ulnar deviation, and a more inflammatory swollen appearance of the larger knuckles. OA produces bony overgrowth and enlargement rather than that sideways drift. People with OA commonly report that rings no longer slide over their knuckles because the knuckles have become thicker. From here on, I'll focus mainly on osteoarthritis of the hands, what it looks like, why it runs in families, and most importantly, what you can do about it. Thumb arthritis deserves a special mention. The base of the thumb is one of the most frequent trouble spots for OA. It often affects the dominant hand more, and it can get really painful after routine tasks like typing, texting, opening jars, or even holding a book. On exam, that thumb base can appear squared or prominent as the joint changes its shape. That squaring and bony bumping is a common early sign of thumb OA, and many patients recognize it immediately once they see it. There's also a strong hereditary component to hand osteoarthritis. If your mother or father or grandparents had knobby arthritic hands, there's a good chance you may develop a similar pattern. Clinically, we see families across generations where hand OA appears in a predictable way. Even if older family members didn't complain, the hand shape often gives the answer. The resemblance is usually striking. Genetics can't be changed, but knowing your family history can help you be proactive earlier. So what can be done once OA is present? The short answer is, we don't have a pill that restores worn joint cartilage. Surgery is the only option that actually changes anatomy. And for severe disabling cases, hand surgeons can do excellent work, from joint-preserving procedures to fusions or replacements when needed. But most people manage their symptoms without surgery. Treatment focuses on preserving hand function, reducing pain, and improving strength. A sensible stepwise approach is useful. Topical treatments. There are many topical anti-inflammatory creams and prescription-strength gels that can ease pain locally. These are low risk and often worth trying before systemic medication. Oral pain relievers. Over-the-counter options like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, can help control flare pain. Always use these under the guidance of your clinician, especially if you have other medical conditions. Injections. Steroid injections can sometimes offer relief in small hand joints, but they are less predictable than injections in larger joints and may be uncomfortable because the joint spaces are tiny. In my opinion, steroid shots in small hand joints should be used sparingly. A carefully selected one-time injection can be helpful, but repeated steroid shots aren't ideal for long-term joint health. Newer options like PRP or stem cell injections exist, but the evidence supporting them is limited at present. So I'd advise a cautious, evidence-based approach before pursuing those therapies. Physical therapy. In my experience, and supported by the best evidence we have, hand therapy delivers some of the most consistent long-term benefits. Targeted exercises strengthen the tiny muscles of the hand, improve grip, and break the cycle of weakness and pain. Strengthening exercises don't change the bony changes, but they often improve function and reduce discomfort substantially. If access to specialist hand therapists is limited, guided home programs or virtual therapy can still help. Assistive devices and activity modification, splints, jar openers, enlarged handled utensils, and simple changes in how you perform tasks can reduce strain on painful joints and preserve function. One bright development is technology that increases access to good hand therapy. There are apps that use the smartphone camera to guide gamified hand exercises. Think simple game-like challenges controlled by specific hand movements. These apps can track progress, provide exercise programs similar to what a therapist prescribes, and even connect users with a therapist for remote coaching. This kind of digital rehab is a promising, forward-thinking way to bring evidence-based hand therapy to more people, especially those who don't have easy access to in-person care. It's also important to separate arthritis from pain. Having osteoarthritis changes joint anatomy, but it does not automatically mean a lifetime of disabling pain. Pain is a complex experience influenced by sleep, cardiovascular fitness, stress, relationships, diet, and mood. I routinely see patients with severe-looking arthritis on imaging who report minimal pain and high function, and others with relatively modest structural change who have significant pain. That's because pain pathways and the brain's processing of pain are shaped by many factors beyond joint structure. So in addition to hand-specific treatments, address the whole person contributors to pain, prioritize good sleep, keep moving, not just hand exercises, but cardiovascular activity that gets your heart rate up. Nurture supportive relationships that energize you rather than drain you, manage stress and cortisol levels, and eat a balanced diet. These elements all influence how strongly pain registers and how well you cope day to day. To summarize, know the differences between OA and RA. OA tends to be localized and shows bony changes in the PIPS, DIPS, and thumb base, whereas RA is inflammatory, systemic, and involves different joints. Thumb base OA is very common and can be especially limiting. There's a clear genetic tendency to hand OA, but there's also a lot you can do to manage symptoms. While we don't yet have a medication that reverses the joint damage, a combination of topical/oral therapies, judicious use of injections, focused hand therapy, assistive devices, lifestyle optimization, and, when necessary, surgical options can preserve function and reduce pain. In my view, strengthening and maintaining function through therapy and healthy living, combined with conservative medical care, is the most reliable path to staying active and enjoying life despite hand arthritis. I hope this clears up some of the common questions you hear in clinic and gives you practical steps to try at home. Take a look at your family's hands. Sometimes that simple comparison tells a story. And consider hand strengthening work even before pain becomes severe. If this video helped, please hit like and subscribe. It really does make a difference in getting useful information to more people. Thanks for watching, and we'll see you next video.